crisis management, there are 4 phases to know for your exams. The first phase is the trigger event. This is anxiety in response to the threat. The second is escalation, increased anxiety and agitation. The third is the crisis phase, where we see outbursts, violence, and even shouting. And the fourth is post-crisis disorganization and even depression. So ATI mentions, which of the following best describes what should be in the first box? Trigger event. As you can see, the boxes have trigger event, escalation, crisis, then disorganization. And Kaplan mentions, the client states, I feel like I can barely get out of bed in the morning. The nurse recognizes the client is in which stage of the crisis? Disorganization and depression. Now, in terms of interventions, there are ways to decrease crisis and physical violence, but we always use least invasive first. So we have communication first, medication second, and then very lastly, physical restraint and seclusion. So for communication, number 1, big NCLEX tip here. Explain all activities of care clearly and calmly. Huge NCLEX tip. So Hesse mentions, the patient becomes agitated and threatens to harm a staff person. Which nursing intervention is appropriate? Address the patient with simple directions and a calm voice. And Kaplan mentions, when intervening with a violent client, the nurse takes which action? Identifies the nurse to the client and remains calm. Now, number 2 is eliminate the trigger. And 3, a low stimulation environment. So not near the nurse's station, but away from the nurse's station. And number 4, determine the source of anger. And lastly, number 5, acknowledge the client's emotions. So ATI mentions, a client becomes agitated and threatens to punch the other client. What is the priority action by the nurse? Eliminate the trigger using nursing measures and interventions. And question 2, yelling and screaming at the staff. Which actions should the nurse take? Determine the true source of the client's anger. And the last question, angry and throws a chair in the day room. Which of the following interventions should the nurse perform first? Acknowledge the client's emotions. Now, if violence is unavoidable, then we must promote safety and gather other staff members. So Hesse mentions, a client bursts out in a verbal tirade in the day room. The client has a history of poor impulse control. What is the nurse's priority action? Remove other clients from the day room. Yes, this promotes safety. And a second question, when approaching an angry patient, which safety consideration should be taken? Have other staff as backup and stand far away to avoid injury. Now, in terms of pharmacology, this always comes second if communication fails to de-escalate the client. We use 3 types of drugs. The first type is anxiolytics. These are benzos ending in PAM and LAM. The key one to know is lorazepam, brand name Ativan. The second category of drugs are antipsychotics. The 2 big ones to know are haloperidol, brand name Haldol, and ziprasidone, brand name Geodon. So ATI mentions all 3. A client who's displaying violent behavior, which of the following medications should the nurse expect the provider to prescribe? Select all that apply. Lorazepam, or benzodiazepine, haloperidol, brand name Haldol, and ziprasidone, or brand name Geodon. And very lastly, if all else fails, then physical restraints and seclusion is used very last. On the NCLEX, we try to stay away from choosing this first, only very, very last. So number 1, get an order for restraints, and we must renew this order every 4 hours with adults. Number 2 is the client must be assessed by the HCP within 1 hour of the order for restraints. And number 3, when a client is in restraints, we must document every 15 minutes. You must see the client and assess them. And lastly, number 4, monitor and meet the physical needs of the client when they're in restraints. So Hesse mentions, physical restraints are placed on the client, and then the client is put into the seclusion room. Which actions must the nurse take in the next hour? meet the physical needs of the client, obtain a prescription for the restraints, and objectively document the client's behavior. All right, that wraps it up. Thank you